My name is Stephen Myerthall. I'm an orthopedic surgeon and I work for the Core Institute. I did my fellowship at the Mount Sinai Hospital in Toronto, where I specialized in reconstructive surgery of the adult hip and the knee with Dr. Alan Gross. I did my residency also at the University of Toronto. I was there for 6 years. Before residency, I did medical school at the University of British Columbia, which is in Vancouver. My undergraduate degrees are a Bachelor of Physical Education and a Bachelor of Science in Physical Therapy. I come from a family where there's a few physicians in the family. With my undergraduate training being in physical education and physical therapy, I always enjoyed learning about the human body, about the movements of the human body, about diseases of the human body, and ultimately a career in medicine and then a career in orthopedic surgery was a logical choice for me. I chose to specialize in hip and knee surgery because I enjoy working with elderly people who are otherwise very healthy, but their lifestyle is significantly limited by hip pain or knee pain. I find it very rewarding to take someone like this whose lifestyles are cramped or are inhibited because of pain that they have in one of their joints, go about repairing that joint through surgery and returning them to a rewarding lifestyle. So I was in Arizona for several years working before the Core Institute started here, and when I first met the founding partners of the Core Institute, I was extremely intrigued by their motivation to start this group, placing the patient first, placing care of the patient first, looking at evidence-based medicine, looking at innovation in the treatment of patients. And I thought it would be the next step from moving from the practice that I was in into this practice. My role in the care continuum of a patient is to make the patient first feel comfortable with me. After that, I want to make sure that they understand what the problem is. I want to make sure they're educated as to the solutions to that problem, whether they be operative or non-operative solutions. And ultimately, I want them to feel when a decision is made for treatment that they've had a role to play in that decision that is made. My care philosophy is to treat the patient first. Treat the patient when they come to see me in my office or when they come to surgery. I want them to feel that they are the single most important person that I'm going to deal with on that day that I see them or treat them. The most rewarding thing about being an orthopedic surgeon is the reward of returning people to a healthy, active lifestyle.